We're going to do an energy work treatment to help people who are pregnant, most of whom are women. Now, what we use, the points we use, really depend, first of all, on the individuals, what their needs are, but also on the groups that the people belong to. There are points and areas in the body that are specifically important for humanity in general, others for particular national groups, racial groups, etc. For example, in North America, it doesn't matter what race people belong to. Working on the hands is important, especially the chakras in the hands, because the chakras in the hands contain the sacrifices we make in our exchanges in the world. In North America, on the right hand, women who are pregnant tend to try to want to do everything. And what happens when we work on this chakra, if we do it in the right way, the woman is able to relax. What happens on the left hand is the woman is trying to be kind of Ms. Perfect Mom or Ms. Perfect Earth Mother, serene and calm and all of this. What she tends to do is she tends to deny the little child inside her. So when we work on this hand, the little child can come out. And that's actually very good, not only for the woman, but it's good for the baby, because it helps the baby and the woman come into the new life element, that wow, something new is happening here. And the child element in the woman can start to come alive, and that really helps the baby really being wanting to be born. So that's North America. In China, and this is also in general for people, it's supporting the baby bump, supporting the baby, because in China, women are so, it's almost like culturally, they're so used to giving birth, they take it as a part of normal life, and it is, but it's more than that. So putting the hands here and connecting to the baby is a way to bring the mother's attention to the baby and to support the baby-mother connection and the baby's beingness in the mother. In Africa, there are different needs. For example, in Africa, there's a need to work on the mother's knees, also the need to work on the mother's ankles, because in Africa, one of the things that African women have told me is that they're kind of looked upon as fertility machines. So they tend to pay attention, a lot more attention to the family and the burdens of raising all the children to their own life path. And in order to be a good mother, and at this time in history, the woman has to also follow her own life path, not just be a part of a family group. So working on the knees helps people to come into their best life direction. Working on the ankles helps people to be flexible in the same way, in the same time that they are centered in themselves. And also, it helps people to release family and personal shadows working here. Also for Africans, it's important to connect to the front and the back of the abdominal chakra, which gives emotional support.